Hello everyone, I'm here in Las Vegas for the joint meeting between the American Academy of Oral Medicine and the European Association of Oral Medicine, where I had the chance to talk with several members of the Editorial Board of the Journal of Oral Diagnosis and ask them to share their perceptions about present and future of oral medicine, oral pathology, and oral diagnosis in general. Here's what they said.
Hello, my name is Nat Treaster. I'm an oral medicine specialist in the United States. I am the division chief of the Division Oral Medicine and Dentistry, Brigham and Women's Hospital in Boston, Massachusetts. I'm also affiliated with the Harvard School of Dental Medicine. I've been involved in the field of oral medicine since I started my training in the year of 2000, faculty member since 2004. I'm highly dedicated. I love the field. I love the practice. I love teaching. I love research opportunities. I love ways in which oral medicine integrates with all different aspects of medicine and the healthcare system, and ways in which we have an impact. And the opportunities for research are really from top to bottom, left to right, inside and out. And hope you find it interesting.
Catherine France. I'm an assistant professor of oral medicine at the University of Pennsylvania School of Dental Medicine in Philadelphia in the US. I think it's a really exciting time for oral medicine in general right now on a lot of different areas. I think that people are practicing oral medicine in different settings and in different ways than they ever have been, and really expanding both patient and other providers' awareness of our specialty, allowing us to grow in number and in reputation as time goes on. I think it's also a really exciting time for oral medicine research. We see a lot of growth across areas, including in new devices and new ways to treat things like mucositis that have been really long-standing, persistent problems without good solutions. I'm also excited to see if some of the new imaging and some of those same types of interventions may allow us to diagnose other diseases sooner and therefore treat them better as time goes along. I hope that if you're working on any of those things or anything else related to the future of oral medicine, you'll consider submitting your research to the Journal of Oral Diagnosis. We'd love to have it, and please keep track of the journal as we continue to grow.
Hello everyone. Hi, how you guys doing? My name is Adepiton Owasher. I'm a professor of oral medicine and oral pathology from the Missouri School of Dentistry and Oral Health in St. Louis, Missouri. Also a faculty with the Washington University, Department of Otolaryngology with Banjush Hospital in St. Louis, Missouri also. I've had the opportunity to be on the editorial board of the Journal of Oral Diagnosis and also on the editorial board for the Quadruple Journal. Well, what really fascinates me in the field of oral medicine, oral diagnosis, and oral pathology is actually in the area of cancer management, detection, managing the oral complications of cancer therapy, especially looking at the possible oral complications. And I do think one thing I would really like us to focus on in our research work going forward is talking about early detection, because we do know that much hasn't really changed in the survival of oral cancer patients. You can kind of think about it. Most times by the time they're diagnosed as stage 3, stage 4, and at that point prognosis is poor, and they tend to have morbidity associated with their therapy. So early diagnosis will go a long way, if you can start detecting these cancers very early on, hopefully at stage 1, stage 2. So I would love to see more research studies focusing on that, on those possible ways on detecting this cancer much earlier. And another thing of interest also is managing these complications. Every single day there are new oncologic therapies that are being developed, and I say definitely that would also cause new oral complications. And it would be nice to start getting a hold of on how to manage those new complications, and even more importantly, to prevent them. And I would actually like to thank the editors of the Journal of Oral Diagnosis for giving me this opportunity to give this brief talk. And for everybody that's interested in the topics I mentioned and everybody that knows me, please, if you'd like to watch this video, you can go to the Journal of Oral Diagnosis to watch it.
Bom dia, daqui de Las Vegas. Estamos aqui no Congresso de Oral Medicine, Academia da Medicina Oral dos Estados Unidos e junto com o grupo da Europa. Estamos aqui com um grupo muito grande de brasileiros, o que para mim me deixa muito feliz de saber que a gente planta uma semente e essa semente floresce e nós temos uma representação muito grande do Brasil agora na medicina oral do mundo inteiro. O congresso está sendo muito bom, os brasileiros estão apresentando trabalhos ótimos e eu continuo dando a minha contribuição como um avô de toda essa turma, mas muito feliz. A medicina oral brasileira está ao mesmo nível de todas as outras no mundo inteiro e, se não, até acima em função do grande número de pesquisas que é produzido pelos brasileiros e publicado nas revistas internacionais. Eu fico muito honrado de fazer parte desse grupo e falando em publicação, eu espero que vocês visitem o site do Journal of Oral Diagnosis. É um jornal ligado à SOBEP, que é peer reviewed, é muito importante para que a gente possa divulgar cada vez mais o trabalho nosso na especialidade. Obrigado e um abraço a todos.
Buenos días a todos, saludos desde la reunión conjunta de las Sociedades Americana y Europea de Medicina Oral. Mi nombre es Marcio Diniz, soy profesor en la Unidad de Atención Odontológica a Pacientes con Necesidades Especiales en la Universidad de Santiago de Compostela, en España. En medicina oral hay dos áreas que me entusiasman especialmente en este momento. Por un lado, la integración de la inteligencia artificial en el diagnóstico y la toma de decisiones clínicas, y por otro, el mejor conocimiento del microbioma oral y su impacto en la salud sistémica. Creo que avances en estas áreas pueden abrir nuevas posibilidades para mejorar la atención clínica y la calidad de vida de nuestros pacientes. Para mí es un verdadero honor formar parte del comité editorial del Journal of Oral Diagnosis, la revista oficial de la Sociedad Brasileña de Medicina y Patología Oral, y me gustaría invitar cordialmente a colegas de todo el mundo que envíen los resultados de sus investigaciones al Journal of Oral Diagnosis. Sigamos avanzando juntos en la ciencia y en la práctica de la medicina oral. Muchas gracias.
Hello everybody, my name is Markéta Dneska. I'm oral medicine specialist at the Department of Oral Medicine in Prague, Czech Republic, and I am also been appointed as a chair of the Fellowship Committee of American Academy of Oral Medicine. Given the undisputed increase in both prevalence and incidence of inflammatory bowel disease, and even nowadays we may see the increasing prevalence of these chronic relapsing systemic conditions. So the focusing of my research on the oral manifestations of IBD was pretty inevitable. Guys, Brazilian Society of Oral Medicine and Oral Pathology is on the rise. So the submitting of your fabulous research into its official journal is more than rational, as it will provide you with the exceptional opportunity and the golden opportunity to really pump your reference list up. So do not hesitate to do it.
Hello guys, so my name is Vivian and I'm an oral pathologist at the University of São Paulo. I'm also an associate editor at the Journal of Oral Diagnosis, and I wanted to talk to you about a bit about the future that I think is related to the publications and what we want to see being published in oral medicine and oral pathology. And especially for oral medicine, I couldn't go without saying some aspects that I think have been discussed here at the workshop in Vegas. So I think we really need to think about the tools that we are using to measure the outcomes in our clinical trials. So whether is it about dry mouth, burning mouth syndrome, leukoplakia, many of the oral conditions, we don't see as many advances in the way we are treating patients. And that might be related to the fact that the tools that we are using are not very either specific, valid, they are not assessing what we need. We are also using different tools, so it's difficult to compare between studies. So please do start thinking about this, the specific tools, the right tools, and I think that will help us to advance more. In the oral pathology field, I couldn't go without mentioning the field that I'm more interested about, which is salivary gland pathology. So I think we also need to consider that this is a very specific population of patients that do not receive the best treatment options. It's a rare type of cancer. Not many centers are studying this cancer around the world. So if you have any studies on diagnostic markers, prognostic markers, if it's basic science, something about drug screening, that is also very interesting. And those are the topics that specifically I'm more interested about.